Hello everyone, welcome back to my channel that is all about medical. So subscribe the channel, share and like the videos. So here I am with a very new informative video for you. Yes, so as you can see the image very clearly, what is written on this image, that ICU instrument. Yes, so we are going to discuss about ICU instruments which are very important to know, and also from the examination point of view. So without wasting time, let's start the video on ICU instruments. So this is our first image. As you can see very clearly, this is the mechanical ventilator and it is used to assist or replace spontaneous breathing. So before coming to the next image, I just want to tell you, if you are new to my channel, then subscribe the channel, share and like the videos, and follow me on the Instagram. And if you guys want any video on a particular topic, then you can drop a comment on the comment section. I will make a video on that topic. So let's see our next image, which is a laryngoscope. And as you can see the image very clearly, laryngoscope is an instrument for examining the larynx or to insert the tube through it. Tube means you can insert endotracheal tube with the help of laryngoscope. So this is our next image, and this is infusion pump. An infusion pump infuses fluids, medications or nutrients into the patient's circulatory system. It is generally used intravenously, although subcutaneous, arterial and epidural infusions are occasionally used, and this instrument is used in ICUs mostly. And this is crash cart, and also known as resuscitation cart. It is mainly used for carrying medicines and equipment for use in emergency resuscitation. This trolley is not only used in ICUs setup but also used in normal wards. So this is crash cart or resuscitation cart. And the next image is of intra-aortic balloon pump. The intra-aortic balloon pump is a mechanical device that increases myocardial oxygen perfusion while at the same time increasing cardiac output. Increasing cardiac output increases coronary blood flow and therefore myocardial oxygen delivery. So this is all about the intra-aortic balloon pump. And this is continuous positive airway pressure, or you can say CPAP. A CPAP machine uses a hose and mask or nose piece to deliver constant and steady air pressure, and you can see the image very clearly about CPAP. I just want to tell you that watch the video till the end, because these instruments are very important from the examination point of view. Don't skip the video. So this is the image of the defibrillator. A defibrillator is an electrical device that provides a shock to the heart when there is a life-threatening arrhythmia present. So this is the image of defibrillator. And this is the arterial line. It is most commonly used in intensive care medicines and anesthesia to monitor blood pressure directly and in real time rather than by intermittent and indirect measurement, and to obtain samples from arterial blood gas analysis. And you can see the whole setup very clearly and the image very clearly of the arterial line. So this is all about the arterial line. And the next image is bedside monitor. A bedside monitor is used to record, distribute and display combinations of biometric values such as heart rate, SpO2 and blood pressure and temperature and many more things. So this is the bedside monitor, and this is used in ICU setup. So This is very important instrument. So this is blood pressure device known as sphygmomanometer, and as the name shows, it is used for measuring blood pressure. You can see the image very clearly. And this is the image of electrocardiograph, ECG, or you can say EKG machine. It is used for recording the electrical activity of the heart over a period of time. So this is all about the electrocardiograph or ECG machine. And this is the electroencephalography, which is also known as EEG. It is used for monitoring electrical activity of the brain. It is typically non-invasive with the electrodes placed along the scalp, although invasive electrodes are sometimes used, such as in electrocorticography. So this is all about the EEG, electroencephalography. And this is the image of the intracranial pressure monitor. So as you can see the image very clearly, it is used in monitoring and treating severe traumatic brain injury patients. And this is glucometer. Everyone watched this device at least once. And this is the glucometer. It is used for determining the approximate concentration of glucose in the blood. It can also be a strip of glucose paper dipped into a substance and measured to the glucose chart. So this is all about the glucometer. So now let's come to the bronchoscope. So this is the device known as bronchoscope. It is used to view all of the structures that make up the respiratory systems. These include the larynx, trachea, and the smaller airways of the lungs, which include the bronchi and bronchiole. This is also used in the ICU setups for bronchoscopy. And now come to our next image, that is colonoscope. Yes, this is the colonoscope. It is used in endoscopic examination of the large bowel and the distal part of the small bowel. So don't get confused in the colonoscope and bronchoscope image. Now you can, watch the image very clearly and differentiate which image is of colonoscope and which is of bronchoscope. And our next image is of urinary catheter. As you can see the image very clearly, these all are urinary catheter, and these are used for the draining urine from the urinary bladder. And now this is the image of the urinary bag, and it is used for collection of urine. Hope you all are very familiar with this image. So this is the image of the suction catheter. A suction catheter is used to extract bodily secretions such as mucus or saliva from the upper airway. This suction catheter is connected with the suction apparatus or suction machine, which gives a pressure, and with the help of that pressure, this suction catheter clean the all secretions from the body. And the last but not the least, the last image is nasogastric tube. It is used for draining stomach content. Nasogastric tube is mainly used to remove gastrointestinal secretions and swallowed air in patients with gastrointestinal obstruction. So this was all about the nasogastric tube.